Good morning, everyone. I am Dr. Qu Xiaohan from Department of Thoracic Surgery. Today, we'll learn the primary mediastinal tumors together. Let's see the outline that we are about to learn. First, we need to know about the definition and the anatomy of mediastinum. Then, we are going to discuss the tumor happened in different parts of the mediastinum. Finally, I will introduce the diagnosis and treatment of different tumors. The thoracic mediastinum is a clinically significant region of the human body. Vital cardiopulmonary structures located in this region. The mediastinum is a broad central chest cavity, separates the lungs from the other structures in the chest. Mediastinum extends from the sternum to the vertebrae and from the superior thoracic inlet to the diaphragm. The borders of mediastinum include the thoracic inlet superiorly, the diaphragm inferiorly, the sternum anteriorly, the spine posteriorly, and the pleural spaces laterally. The mediastinum contains esophagus, trachea, thymus, the heart and great vessels, phrenic nerves, vagus, lymph nodes, and thoracic duct. For organizational purpose, the mediastinum is subdivided into several smaller regions. A transverse plane extends from the sternal angle to the intervertebral disc between vertebrae T4 and T5, separates the mediastinum into the superior mediastinum and inferior mediastinum. And then inferior mediastinum is further partitioned into anterior, middle, and posterior mediastinum by the pericardial sac. After introducing the anatomy of mediastinum, let's learn the important contents of the class, the different tumors in the mediastinum. Different tumors are found in different regions. Most substernal thyroid goiters are found in superior mediastinum. Thymomas are found in superior and anterior mediastinum. Teratoma are found in anterior mediastinum. In middle mediastinum, we can find bronchial cysts and pericardial cysts. Lymphomas are found in middle mediastinum and anterior mediastinum. In posterior mediastinum, neurogenic tumors can be seen in this area. Let's see thymoma first. Thymoma is the most common tumor in anterior and superior mediastinum. Pathological typing depends on WHO typing system, but the Masaoka staging system are much more often used in clinics. There are different types of thymomas. They are generally seen on CT as a round encapsulated mass. Thymic carcinoma is a rare but aggressive cancer. Depending on cell types and shapes, thymomas are divided into type A, type B, and combination of A and B by WHO. Masaoka staging systems are much more often used in clinics. 4 stages are divided by the extent of invasion of the tumor. Myasthenial grafts are found in 15 to 20% thymoma patients. When thymoma patients suffer from MG, they have muscular weakness symptoms such as ptosis, dysphagia, and even dyspnea. MG is also accompanied by some autoimmune diseases such as hypothyroidosis, pemphigus, and red cell aplasia. As for surgery, not only the tumor, but the adipose tissue around thymus also should be resected. Teratogenic tumors are found in anterior mediastinum. They can be divided into 3 types based on its origin of embryos. Epidermoid cyst is made up of squamous epithelium. Dermoid cyst contains squamous epithelium and skin appendages. Teratoma comes from 3 germ layers, and it is made up of several different types of tissues, such as hairs, muscles, or bones. Neurogenic tumors are derived from neural cells and are commonly found in posterior mediastinum. Based on their origin, neurogenic tumors can be grouped to tumors of autonomic nervous system and the peripheral nervous system. Benign neurolimoma has a clear boundary and is completely encapsulated. Malignant neurolimoma is more invasive and no clear boundary can be seen between the tumor and bronchus or pericardium. There are some CT scans of substernal thyroid goiters. They usually located in the anterior mediastinum. Substernal goiter is generally defined as a thyroid mass that has 50 or more of its volume located below the thoracic inlet. The other two CT scans show the mediastinal cyst as an encapsulated and low-density mass. After knowing the tumors' names and locations, let's move on to clinical manifestations. Usually, different kinds of tumors have their specific symptoms, which help us to diagnose. For example, if the tumor moves with swallowing, it usually comes from thyroid. If the patient has a ptosis, which might be one of the symptoms of MG, he may have a thymoma. If a patient coughs up hair, we suspect that he has a teratoma. There are also some symptoms caused by tumor compression. For example, when the tumor compresses the sympathetic trunk, Horner syndrome happens. When the tumors compress the recurrent laryngeal nerve, hoarseness happens. When the great vessels are compressed by the tumors, superior vena cava syndrome happens. When the esophagus is impressed, dysphagia happens. Horner syndrome is a combination of symptoms when the sympathetic trunk is compressed or damaged. It is characterized by a droopy eyelid, an inside eyeball, a constricted pupil, and decreased sweating of half face. Superior vena cava syndrome is characterized by distended veins in the upper chest and arms, swelling face, and upper limb edema. Tumors in mediastinum have a wide diversity of presentation. The location of tumor and its composition are important to narrowing the differential diagnosis. The tests performed most commonly to diagnose and evaluate mediastinal tumors include chest X-ray, are usually the first step in the discovery of a mediastinal mass and can help localize the mass. CT scan of chest is most commonly used and often shows its exact location, whether the mass is well encapsulated or if it infiltrates the surrounding tissues. Item 131 is specially used in diagnosing external thyroid goiters. Tumor biopsy can collect tissues from the mass to determine the type of tumor present for a definitive diagnosis. We can do tumor biopsy by endoscopes such as bronchoscope, esophagoscope, and mediastinal scope. The treatment for mediastinal tumors depend on their types, locations, aggressiveness, and symptoms it may cause. Treatment of primary mediastinal tumors usually requires surgery. Some severely invasive tumors and malignant lymphoma, which cannot be completely resected, are treated by radiation or chemotherapy. That's all for this class. Thank you.